All right, again, welcome everyone. Safeguarding Dental Practices, Addressing Violence in the Workplace. I'm Dr. KRoling. I'm a public health dentist here in Phoenix, Arizona. This is April 22nd, 2024. If you are watching this at a later date, you are watching the recording, so stay tuned for the instructions for those watching on demand later. For those of you here live, please tap on that red banner at the top of the screen to access your handouts. Learning objectives for this evening are there, and they're in your handout. So please, we'll review each and every one of those. If you're a student this evening and you were asked to take this course by your instructor as a part of your curriculum, that is incorrect. We cannot provide you with attendance. Just so you know, you're welcome to audit, but please do not take the evaluation. The agenda, our course is 5 to 6 this evening. Following the course, I'll redirect you all to complete the quiz. You'll have 7 days to complete, and the quiz will expire April 29th. Those of you watching on demand, anytime after April the 22nd, please scroll down below the video player. You'll see number 3 is the quiz, number 2, the handouts. My conflict of interest and financial disclosure, this course is supported by the Alive program today. I am the CEO of Dental CE Academy. I've not received an honorarium, and I have no financial affiliation with the sponsor. I'm an employee here. For any questions, you can reach out through the email there. Here's why I'm here today. Many of us think that violence in the workplace isn't going to reach us, right? We may be practicing in some what appear to be very safe areas of the US and abroad. For me, I was in public health for many, many years, and also private practice. And I'll be sharing some stories with you this evening. And you might think that it was a pretty rough profession. And at times it was. I was in some very remote locations, patients that were considered more high risk. But this is a story that really hit home with me. And for many years, I kept saying, I need to develop a course on workplace safety, because in dental practices, we really didn't have anything. And I'd hear these stories and I'd experience these stories, and I would say, I really need to put this course together. And I just kept putting it off. But why we're all here today is this story. So in February 2019, this dentist reached out to me, Dr. Jack Burrows. He wanted to know how I had so many connections on LinkedIn. And at that time, I think I had, 20,000. Now I have 31,000 plus followers on LinkedIn. And he wanted to know what the secret was. How did I do this? And so it started this communication. And occasionally he'd give me a call and ask me about something, and we'd have more banter. And so he became a friend over LinkedIn. Never met him in person really, but felt like I had a strong connection here. He was a great person. It was fun to talk to him. And so I was reading the news one day, and this is his LinkedIn page right now. It's a legacy page, in remembrance. And I'm reading about 2 dentists that were fatally shot in Tyler, Texas. And one of them was Jack Burrows. And that really hit home with me. And that was in 2022. So he and I met on LinkedIn, through LinkedIn in 2019. 3 years later, he is shot and killed. And affordable dentures. And my understanding, and again, I had no direct conversation with anybody there, but from the reports that I've read, disgruntled patient here, and he wasn't happy with his dentures, and he wanted his money back. And there had been a few encounters with him, and this particular day he was very upset, and he walked out the front door, and he went to his vehicle, picked up a firearm, returned to the practice. Now, the staff saw him apparently get a firearm out of his vehicle, but they could not find the key to lock the front door. And so the dentists were trying apparently to hold the door shut. He was still able to get in, shot them both in the reception area fatally, and then tried to get to the back. But my understanding is a quick thinking staff member was able to lock the back so that he could not get to the back of the practice where the patients were. How many of you can relate to a story like that? I certainly can. You'll be hearing mine today, right? Couldn't find the key, no plan. And again, I wasn't there, and I'm not going to comment on the case much more than that. But we'll see that the key to our survival is, first of all, understanding the danger we're in and having a plan and not letting it get to that point, hopefully. So disgruntled patient, not happy with their dentures. And again, for those of you that have just logged in, please tap on that red banner at the top of the screen. I'm going to play this quick video about that case because these are the patients. And when we hear about these cases, we have to remember that attached to these cases, and this certainly isn't the only case, unfortunately, are other patients that experienced the trauma, family members, and your staff members. So the link is in your handout. In the event you cannot hear this video on your device, make sure that you have the handout.
Well, an East Texas mother and her family were at the dental office when they heard gunfire inside. KTK's Deontay Maroney spoke to the mom and tells us what she witnessed. Deontay.
Yeah, Sarah, I'm here at the dentist's office and you can't see it, but there's a cleaning crew in there cleaning up from this tragedy that took place yesterday. Now, Caitlin Davis was here with her 2-year-old son and cousin. She tells me the shooter joked around with her in the lobby about kids just a few minutes before he allegedly opened fire on the dentist. Davis had just got called to the back of the office when she heard all the commotion. She says the shooter was upset about his dentures and requested a refund.
They fixed it, but he did not want to pay. He wanted a refund, and they couldn't give him the teeth unless he paid.
And he wasn't leaving without his
He
teeth.
took, what started in the back is they took the teeth. He got mad, pushed the doctor, started running down the hall, yelling, cussing at him. They're chasing him.
Now, Davis says she was scared for her and her son's life as she crouched down while the gunshots fired. Her cousin tells me she made eye contact with the shooter as he escaped, and she was able to give 911 dispatchers his license plate number. Now, they both are extremely traumatized by the situation and will be seeking therapy to help cope. I'm reporting live in Tyler, Deontay Maroney, KTK News.
So that was Dr. Jack Burrows and his associate, Dr. Sinclair. And how many of you can relate to that story where if you've worked in a clinic or private practice, you may have had a patient that has been unhappy and an outburst, etc. But are we prepared for the worst? Years ago, when I first started practice, we were told the customer is always right, good customer service, good advice to follow. We don't know the details of that case. I'm sure it's a lot more complicated than we are going to know, and so it's not going to be fair for us to comment on what they may or may not have done wrong, but we're going to look at some things that we can have in place in our practices very simply. And hopefully you'll follow some of that advice today. And I'm going to be sharing some of my stories because when I read about Dr. Jack Burrows, I said, my gosh, I have had so many encounters like that that you'll hear about. And I need to be sharing those so that maybe we don't have another situation like we had a couple of months ago in El Cajon, California as well. All right, so what is the history of workplace violence? Well, since the 1980s, Violence has been recognized as a leading cause of occupational mortality and morbidity. Leading cause. On average, 1.7 million workers are injured every year, and more than 800 die as a result of workplace violence. This was a landmark conference to address workplace violence, and it was in 2004, and I have the link here, and it's a very good document to review. But it summarizes these discussions that took place partnering in workplace violence prevention. And it occurred in Baltimore, Maryland. So story number one I'm going to share with you, and I call this the toss. I was hired to work for a tribal health center, very remote. And I was hired directly by the tribe. It was a tribal hire. So first day on the job, first patient of the day, 7-year-old boy. And I'm sort of having a discussion with him a little bit before I give him an injection. My assistant wasn't there. I don't even remember if I had an assistant. The practice was sort of open bay. It was a very nice clinic, pretty much brand new, but again, very remote area. And all of a sudden, as I'm going to give this injection, I feel hands on my shoulders, picking me up right out of the chair. I weigh about 120 pounds. And I was tossed, that's the toss, across the room, basically, about 10 feet. Never knew what hit me, really. And it was a patient's father. The father and mother were apparently estranged. And the father brought him the son that day, and he was upset because the dentist that usually saw his son was not there that day. And so they had me seeing him instead. And that was not explained to the father. Now, it was a Medicaid clinic, Dentistry clinic. They had an agreement that they signed, a consent form, that any dentist could see their son, but he was very upset. He was also obviously higher than a kite. He was high on probably methamphetamines, also alcohol. And he was, if you looked in his eyes, you were going to die. I mean, it was terrifying. And I'm on the ground bleeding because I hit my face. And my supervising dentist, who was a big guy, he had been in the Marines, and he was in his 60s, and he stood up, he saw what happened, and he ran over and he picked this guy up, the patient, and he towered over this patient's father, and pretty much slammed him up against the wall and held him there until they could call the sheriff's department. And this was a one pony town. They had a little sheriff's department there with a 1-cell jail. The sheriff came in, took the guy away, and etc. And I carried on. I worked the rest of the day. I put a little ice on my face, and there we go. I wasn't really hurt all that badly physically, but I was pretty torn up emotionally. I was having second thoughts about my choice of working there. And they had sort of a debriefing with me. And what happened was that the front office staff sat behind bulletproof glass. This area was safe otherwise, but they still had their staff protected behind bulletproof glass. They had a glass door between the reception area and the back office, the clinical area, that had an electronic lock, and it was supposed to be locked all the time unless they buzzed it to let a patient in or out. But the front office staff got tired of pushing the button and opening the door for the patients, which left us vulnerable to these sorts of things. So that story is called The Toss. What would I have done differently in that situation? I don't know if there was anything I could have done on my part, but certainly there was enough that could have been done by that clinic. Right. They had some safety features in place. They just weren't using it. And they really had no real management around emergency situations. When you have the dentist trying to hold this guy against the wall while they're calling security. I mean, it was extremely violent. It was terrifying. How do we define workplace violence? It can be an act or threat of physical violence. It can be harassment. It can be intimidation. Any threatening, disruptive behavior that occurs at your work site is considered workplace violence. Types of workplace violence can be threats, verbal abuse, physical assaults, and unfortunately, homicide. Who does it involve? Employees, patients, customers, visitors, including spouses and partners. You're going to see that when we see the demographics of assailants in fatal encounters, the number one is domestic partner. So if you have an employee who's involved in an ugly divorce or domestic violence, that can put your practice at risk. You should be aware that that is the case, right? So the number one assailant, you may see that on a quiz, would be someone involved as a domestic violence abuse or partner. So we can't just think of our patients as possibly being an assailant. We have to also think about other employees as well as who they may be attached to. Workplace violence is a major concern for employers and employees nationwide here, and it's the third leading cause of fatal occupational injuries in the United States. This was from the National Census of Fatal Occupational Injuries as of 2022. This is the latest data. And 5,486 fatal work injuries recorded in the US in 2022, a 5.7% increase from 5,190. Fatal work injury rate, 3.7 fatalities per 100,000 full-time equivalent FTE workers. That's an increase from 3.6 per 100,000 FTEs in 2021. A worker died every 96 minutes from a work-related injury in 2022 compared to 101 minutes in 2021. Now, fatalities due to violence and other injuries by persons or animals increased 11.6% to 849 in 2022 compared to 761 in 2021. Homicides accounted for 61.7% of these fatalities. Homicide, 524 deaths, an 8.9% increase from 2021. That's almost a quarter of fatalities due to homicides that occurred while a worker was tending a retail establishment or waiting on customers. And we'll see that workers that handle money or transactional type occupations are at greater risk. Suicides increased 13.1% to 267 fatalities in 2022, despite consecutive decreases in 2020 and 2021. And if you have any questions or comments, please type them in the chat area. And for anybody that just joined us, make sure you have the handout. Tap on that red banner at the top of the screen. All right, what are some of the factors that may increase the risk for workplace violence? Exchanging money with the public, so transactional occupations, working with volatile, unstable people. So we know that our patients that come to see us are already stressed a bit, right? How many times have you heard, I hate going to the dentist? They're breaking out in cold sweats. They may be in pain. They may be fearful. They may have had trauma. Working alone or in isolated areas may also contribute to the potential for violence. Providing services or care, working where alcohol is served, and the time of day and location of work. So late at night, for instance, in a high crime area, will put you at greater risk. Okay, occupations with greater risk. Number one, workers, again, who transact or exchange money with the public. Delivery drivers, number two. Instacart, Amazon, UPS, etc., etc. Healthcare professionals, number three. Public service workers, customer service agents, law enforcement personnel, and those who work alone or in small groups. How do we reduce workplace violence? And we're going to be talking about this in a little bit more detail here soon. Reduce the hazards by recognizing the risk factors, and we're going to talk about those, and a zero tolerance policy. Zero tolerance. I'm going to be telling you a story here soon that happened to me, and it was not zero tolerance. They tolerated everything. They were trying to handle everything internally, and I almost got killed over it. So recognizing reduction and prevention of workplace violence in the dental setting. Let's talk a little bit more in detail. First of all, recognize that you have a risk. And I'm not fear-mongering, it's just pragmatic. You're in an occupation 5 times more likely to experience workplace violence than staff in other occupations. I just gave you the definition. I would be wise to go to Vegas and bet that most of you have experienced some level of violence in your workplace, right? Healthcare workers equal assaults. 10 to 11% of workplace injuries involving days away from work, compared to 3% of those in the private sector. And research indicates workplace violence is underreported, and those rates might actually be higher. My mother was a psychiatric nurse, and she loved her job. In fact, she worked in El Cajon at Grossmont Hospital, La Mesa, California. And one evening she was passing meds, and she worked the PM shift, and she went into one patient's room, and the patient was waiting for her behind the door of the room and trapped her in the door, her head, and almost broke her skull. You know, nurses have a great risk as well. Healthcare workers in general. Okay, healthcare workers face significant risks of job-related violence. And while under 20% of all workplace injuries happen to healthcare workers suffer 50% of all the assaults. The report defined here medical occupations, and these were physicians, nurses, technicians, and other medical professionals. All right, these are workplace homicides that occurred where healthcare workers were the victims, and this is by assailant, okay? And number of fatal injuries. And this was from 2011 to 2018. Notice the number one assailant here, relative or domestic partner. All others, including unknown. Number 3, patient. So in our practices, if we have, again, someone who's going through a domestic abuse case, etc., that should put you on high alert. It really should. You know the risk, right? If you have a disgruntled patient or a patient with a history of violence, that should put you on high alert. And you have to institute zero tolerance policy. Followed by coworker or work associate, other client or customer, acquaintance, and then robber. Again, if you have any questions or comments, please type them into the chat area, and be sure you have the handout. I see about another 100 of you logged in. Access that handout at the top of the screen. Okay, so let me tell you my next story. I was working in a public health clinic, and this was a very large clinic. It had a wide hallway and probably 10 or 12 operatories on each side. And all of my dental assistants but one were male because we worked with the public, and we had a day where we were really busy, and was double booked actually. I had a provider that called in sick. I'm waiting for them to bring the patient back because we're running behind. And I see my assistant coming down the hall with the patient, and they get almost to the operatory. I'm waiting in the front for them. And then the lead dental assistant came flying down the hall behind them and stopped them and said to the patient right in front of me and in front of God man, yelled out, "Look, we can't see you today. We told you before, you can't come in here drunk and high. She is not going to see you. So you need to go home." Now, I had not even had a conversation with the patient. I'd never seen the patient. The patient was there. I could tell the patient had some sort of infection going on. He probably waited a long time to get in there. And he went berserk. He started screaming, fist on the wall, pounding. He's not going to go home. He's not drunk. He's not going home. The lead dental assistant said, "No, you're going home. She can't see you like this. We've told you before. You go home." The patient turned to me and started yelling, "I'm going to go home. I'm going to get my gun, and I'm going to come back here, and I'm going to kill you, and I'm going to kill you." And he pointed to the dental assistants. "And I'm going to kill everybody in here." And he's yelling that in the clinic. The dental assistants, who formed a sort of tight-knit clique group there, started laughing at him, egging him on. So, "Yeah, go ahead, go get your gun. Yeah, go get your gun. Go ahead." Where was the management? It wasn't there. They had handed the whole responsibility of this to a lead dental assistant who had zero background in de-escalation. He thought it was funny. The patient started walking down the hall, and he was knocking things off of counters as he went, and he walked out the front door. And I said to the assistant, "Are you going to call security or something?" This was working for a health department, Health and Human Services, in a different state. He said, "No, we handle this internally." He always says that, doctor. He always says he's going to shoot somebody, but he takes a bus and he doesn't do it. He doesn't come back here. I said, "No, I'm not walking out the door here today. This guy just threatened to shoot and kill me." "Oh, he won't do it. He does it all the time." So I went to the office manager. "What is the plan here? We just had a guy who wants to come back with a gun and shoot and kill us all." She said, "Oh, we handle it internally." I said, "What does that mean?" "Well, if he gets violent, we'll call security." I said, "He just said he was going to get violent. He's on his way to get a gun." So he takes the bus. He does this. He's drunk. He'll come back. He's fine. At what point do we call security or the police? Was my question for her. She said, "Well, we take it on a case-by-case basis." I said, "Great." I pulled out my cell phone. I called the police. The police came and took my report. The police came and then took her report and the dental assistant's report. And to my surprise, the other dentists that were in there working thought it was a bad move on my part to call the police. They thought that was overstepping my role there as a clinician. You know, I hate to tell you, I don't care if I'm in a dental practice or at the zoo. If somebody's threatening to shoot and kill me, I'm going to call and report it to the police. And if you have an employer that's going to think this is okay, it's not okay, because you don't know when that patient's going to come back. He's telling you what he's going to do. You have to act on that. Okay, so again, we're going to talk about what we need to have in place very basically to make sure that everybody's on the same page, so that you don't have a dental assistant who thinks this is a joke. Certainly, if you have given that much authority to the lead dental assistant, then that lead dental assistant needs to be trained properly. And everybody needs to be on the same page. But we're going to see some of the risk for this is high turnover, right? If you have employees just coming through your front door, chances are they're probably not well trained. All right, so patient and setting related risk factors: working directly with someone who has a history of violence, abuse of drugs or alcohol, gang members and relatives of patients or clients, transporting patients and clients, working alone in a facility or in patients' homes, poor environmental design of the workplace that may block your vision or interfere with your escape when there's a violent incident, poorly lit corridors, rooms, parking lots, other areas, lack of means of emergency communication, the prevalence of firearms, knives, and other weapons among patients and their families and friends. We've had a couple of questions about that here. And working in neighborhoods with crime rates, high crime rates. So the question here is, could I refuse to see that patient? You know, I probably could, but what's it going to do? If he's in a cubicle three operatories down and he's already threatened to come in and shoot everybody up, he needs to see the police rather than the dentist, and probably mental health. Good questions and comments here. Can we dismiss that patient who threatens us by documentation? Yes. But you have to document it, because they can still file a complaint. And you can just have your documentation. We had to call the police. He made verbal threats. You won't have a problem. But you do have to make, in some states, accommodation so that they can get referred to somebody, give them time to get referred. A question here: can a carry and conceal person bring in a gun with them for an appointment? You can have a policy that they leave their gun out of the practice. Just like here in Arizona, when you go to the Starbucks, there are some businesses here. All right, so related risk factors here we reviewed. But I would like to say, don't let your guard down if you think, well, I don't work in a neighborhood with a high crime rate or et cetera, because I'm going to be telling you a story here and that will curl your hair. Okay, organizational risk factors. Lack of facility policies and staff training for recognizing and managing escalating hostile and assaultive behaviors from patients, clients, visitors, or staff. Working when understaffed, especially when there are meal times or staff breaks. You don't have enough folks there, maybe. High worker turnover. Inadequate security personnel on site. Many of you private practices, you don't have a security person on site, right? You have the local police that you'd have to call. So you have to have some protocol in place to where you get to that point. Long waits for patients or clients, overcrowded, uncomfortable waiting rooms. Unrestricted movement of the public in clinics and hospitals. I just gave you the example where any patient in this particular clinic could walk to the back and pick up a dentist and toss them across the room. Right? So we have to have these policies in place. We have to evaluate those policies and make sure they are implemented correctly and that there are no unintended consequences of those policies. And also the perception that violence is tolerated. I just gave that explanation or story. And victims will not be able to report the incident to police and or press charges. So we have to have some sort of violence prevention program, and it's a written program incorporated into your overall safety and health program, and offers an effective approach to reduce or eliminate the risk of violence in the workplace. And it needs to include management commitment and employee participation. Everybody has to be all in. You have to have good communication between management and your teams, right? Worksite analysis. There are some professionals now that will come in and walk your practice for you and tell you maybe you may want to redesign a couple of things. And that's really hard to take in this world right now, that we have to even think about this, but we do. Hazard prevention and control, safety and health training, record keeping, and program evaluation. To drink a lot of water. It's Arizona and we're at 100 degrees today already. It's really dry. All right, I call this story the Red Corvette. And this was a case of where what I just explained to you wasn't in place. I was right out of dental school in private practice. Now, I was trained in a very urban school at UC San Francisco. San Francisco General Hospital doesn't get much more urban and dicey than that. And we were trained, never get yourself backed in a corner. Always have an exit. So if we were interviewing a patient, etc., that we should have our back to the doorway if something happened. So nice private practice setting. This patient comes in, beautiful Corvette, red convertible Corvette, nicely dressed, beautiful suit. He was a walk-in. Of course, I was the new associate, so they were going to give me the walk-in. I was excited. He's filling out the health history form, and I'm thinking, I wonder what his story is. I mean, he's obviously some sort of professional. They brought him back to the operatory, and his chief complaint was that he was hearing voices from a crown that was placed by another dentist. And he wanted to know if I could remove the tooth that day. So the voices were telling him to do things. And I was just blown away by this because it was not what I was expecting at all, right? So I went ahead with him, and I was sitting, taking this history from him and trying to be respectful of what he was telling me, not judging him in my mind, but realizing it sounds to me like I have someone here that, for whatever reason, has paranoid schizophrenia. And he has voices telling him to do some scary things. And what do I need to do here? So as I'm taking his history, he said to me, "Do you think these voices are from my tooth?" And I said, "I don't think they are." And I think he would have these minutes of being somewhat lucid. And he said, "What do you think I need to do?" And I said, "I think I need to get you referred to the hospital and get you evaluated right away. How do you feel about that?" And he said, "I would be happy if you did that for me." I said, "Okay, let's go ahead and get you evaluated." So I referred him to UCSF. They have psych emergency, and I called them ahead of time to let them know I was referring a patient. And they kept him for 72 hours. But because he was not a danger to himself and others, he was discharged. And where did he go when he was discharged? He came back to our practice. And he was back there again, and he wanted the tooth removed. I walked in the morning, and there he is sitting there waiting for me. I'm going, oh gosh, what are we going to do? So I sat there again, had a nice conversation with him. And I said, "Look, we had the discussion. This isn't your tooth." He said, "Well, I know that, but I just want to be sure. I just want you to take the tooth out today." And I said, "Well, I have the x-rays from the other dentist, and there's nothing wrong with this crown." And he would say to me, "Do you see the satellite in there?" He was asking me. He, in his background, he was a software engineer, Silicon Valley, very early days of Silicon Valley. I said, "I think we need to have you seen again." And he said, "I think I agree with you." I said, "All right." I said, "I'm going to refer you I'm going to call the hospital and see if they have someone I can refer you to." So we ended up getting him referred again. and I didn't see him back. I said, after they see you, I'll be happy to take care of all of your dental needs, but I need to make sure that we have you all checked and cleared. So he said, okay. And he was very friendly, very cooperative. And a few days later, I'm driving into my office early and I see his car, the red Corvette, and it's parked maybe because I'm coming down a grade like a block away. It was not in our parking lot. And there was a payphone there. This was before cell phones, really. And I could see as I turned into our parking lot that he was on the payphone, probably trying to call our office again. And this time I came in and I told the front office, we're not going to see him again. If he comes in, we're not seeing him today. We had nothing on the schedule. I said, I have to figure out what I'm going to do. But what I underestimated here in my delay of not knowing exactly what to do with him, what I underestimated was the effect it was having on my staff. They were terrified. And the fact that this guy may have been stalking me, which that's what it turned out to be. It was a stalking case. And not just a paranoid schizophrenia case, but a stalking case, a full-blown stalking case where I was in danger. And I didn't really understand that until my dental assistant's husband, who ran security for a casino, called me and said, look, Kirsten, I'm really worried about this patient that you have. I think it's an escalating stalker situation. He knew security. He had worked for law enforcement. He said, I would feel better if I could call the police and help you with this. And that's what he did. And they took him into custody. I ended up getting a stalking order and never saw him again. But that was me being clueless. I was completely clueless. Yeah, I was completely clueless. Plot twist. So we have to think about that part of it too. What happens when a patient may not be ugly and violent, but maybe they have a mental health disorder. Maybe they're stalking your employees. What do you do? What are you going to do to protect your employees? For me, I did nothing. I threw them in the ring. Don't schedule the patient anymore is what I told them. I can't see him. We can't treat him, right? My front office staff is like, what do we do? He's calling us from the payphone. So that's the red Corvette story. We have to be more in tune to how these things affect our staff members as well. Not just the training, but how our decisions affect them as well. Because seeing violence and being exposed to that sort of situation is stressful on our staff. We're not productive. I think so, Doris, especially back in the day. You know, we were advertising and the advertisers were using me in the marketing. And this was really early on before we had any sort of marketing like that. And I was told, no, don't do that because that puts you out in the public eye. They did evaluate him and they released him again. And the first time when they evaluated him, they could only keep him for 72 hours because they determined he wasn't a danger to himself or others. He was walking around. He was going to work. He was gainfully employed in Silicon Valley. But he had been stalking me. And my employees would also say, you know, we saw his red Corvette down there by the coffee shop yesterday afternoon. Thinking, I thought, you know, and we knew the guy worked in Silicon Valley, the patient, because he had insurance and we got his records from the other dentist. And, you know, you don't expect, none of it seemed to fit at first, which is kind of what threw me off. But again, my whole reason for bringing this up is that I didn't think about my staff. I didn't think about the effects it had on my staff. I was too busy trying to figure out what I was going to do with this patient and so forth and so on. I wanted to let you know that there are now some state mandated requirements. Several states have passed legislation that require training in workplace violence to address it. An example here is California's SB 553. Many of you may know about it. If you don't, that link is clickable in your handout. You should find out about it because in July, every employer, I think, except for those with less than 10 employees, but don't quote me on that. You're going to need to check with HR, whoever you use, to find out if you have to implement this training. And if you do, reach back out to us because we'll have a resource, hopefully, here in about a month. So this is California's state mandated requirement, just for example. And it was signed into law underneath the California Labor Code. And it'll be enforceable July 1st of this year. Employers that fall within the scope of this law must establish, implement, and maintain an effective written workplace violence prevention plan that includes but is not limited to the following. Identify who's responsible for implementation involving employees and their representatives, accepting and responding to reports of workplace violence and prohibit employee retaliation, communicate with employees regarding workplace violence matters, responding to actual and potential emergencies, develop and provide effective training, identify, evaluate, and correct workplace violence hazards, and perform post-incident response and investigations. Uh, 10 or less if they do not interface with the public. Correct. Thank you. So again, I'm not an attorney. That's the law that's going to take effect here in a couple months in California. And there are states that aren't too far behind. So find out what's going on in your state. Management commitment and worker participation. So what's required here is a top-down approach. You know, management needs to buy into this and provide this training. And ethically, we should be providing this training, but first of all, acknowledge the value of a safe and healthful violence-free workplace, right? So it requires collaboration between management and the employees. Allocate appropriate authority and resources to all the responsible parties. Provide resources that include financial, access to information, personnel, time, training, tools, and equipment. Assign responsibility and authority for various aspects of the workplace violence prevention program so that all the managers and supervisors understand their obligations and the expectations. Maintain a system of accountability for involved managers, supervisors, and workers. Supporting and implementing appropriate recommendations from safety and health committees. So for large organizations, they may form a committee that represents different departments and different levels of responsibility. Establish a comprehensive program of medical and psychological counseling and debriefing for workers who have experienced or witnessed assaults and other violent incidents, and ensure their trauma-informed care is available, and establish policies that ensure the reporting, recording, and monitoring of incidents and near misses, and that no reprisals are made against anyone who does so in good faith. So management should articulate a policy and establish goals, allocate sufficient resources, and uphold program performance expectations. That's a duplicate there. Okay, work site analysis and hazard identification. So question here, what if management doesn't acknowledge the dangers or incidences and reporting documentation? So you have the right to talk to management and voice your concerns. You may want to put that in writing to them. If you had an incident, your concerns. And if they don't move forward with a plan. In some states, you can file a complaint. Okay, and you'd file it with your labor board. You could start there. It depends on the state that you're in. All right. If they're not going to do anything to improve where you're working, and you find yourself, like me, calling the police on yourself to protect yourself, then you may want to reevaluate where you're working, right? We don't all have that luxury, though. Maybe that's a job we've been in for 10 years and we don't have any other place to go. But you have to give them a letter in writing and let them know what your concerns are, right? If it can be, I'm not an attorney, but I've seen cases where it can be considered a toxic workplace, etc. It depends on the type of workplace violence too. But that's a good question, because we know mahogany, it exists, right? You may have management that doesn't want to acknowledge it. We're going to see shortly here some resources for you too. All right, so a worksite analysis is a step-by-step assessment of the workplace to find existing or potential hazards that may lead to incidents of workplace violence. Right, so if we go back to my story, the toss, where the patient's father came through the reception area to the back, probably somewhere in their books, they had this policy that that door was supposed to remain locked. Now, it remained locked after that incident for a while, but sometimes we get complacent, right? Or you have high staff turnover and one person decides they don't want to lock the door anymore. So again, find the potential hazards, but you don't know what you don't know. And sometimes you have to rely on the professionals. Cooperate between workers and employers in identifying and assessing hazards. So have a meeting with your staff. If you're a smaller practice, meet with your staff members and find out what situations here concern you. Where do you feel threatened? Find out. They can tell you. Be in touch with what's going on with your employees. Should include a team of management, supervisors, and workers. So management is responsible for controlling hazards. Workers have a critical role to play in helping to identify, assess those workplace hazards because of their knowledge and familiarity with the facility operations, the process activities, and the potential threats. So by having just even a practice meeting, if you're a smaller practice, you may be surprised to the doctors out there what your staff tells you. They may have an issue. Maybe you do have a lockable door and it's not being locked, and somebody tells you, hey, I'm concerned, or I saw this happen one day. Can we do this differently? Keep the lines of communication open. Don't do like I did and just say, well, just don't schedule the patient again. Yeah, I don't want to see him in the waiting room anymore. We've done all we could. Worksite analysis and hazard identification. So this assessment should include a records review, a review of the procedures and operations for different jobs, employee surveys, and workplace security analysis. And keep in mind, with California's SB 553, all of this is in there. There's a stepwise training program that has to occur. And in big organizations, their HR department will do it. But for smaller organizations, reach out to us because we're putting something together. All right, worksite analysis should be used to identify the types of hazard prevention and the control measures needed to reduce or eliminate the possibility of a workplace violence incident occurring. It should assist in identification, the development, and frequency of appropriate training. Easy for them to say, right? Some of this you may just not even be aware of. And that's why we want to put you in touch with the professionals. For instance, your business office. Should you have a glass door on it that people can see you in there? Probably not, if you listen to the professionals. I'm going to show this quick video. This was Dr. Ben Harouni in El Cajon, California, 28 years of age. And again, I have not had direct conversation with anyone that was involved in that horrible, horrific situation. This was a patient that had been a patient of record for 3 years. And the office manager, who was also injured very seriously, tried to console this patient for a 3-year period. You're going to hear that the journalist who reported on this called the El Cajon police to see if there had ever been a report made by the practice on this patient, and there wasn't. So they were trying to handle it internally. And again, the link is for you in the handout. Let me go ahead and put that video up for you.
The man accused of killing an El Cajon dentist and injuring 2 of his staff members is headed to court tomorrow. This comes after a weekend of mourning for Dr. Benjamin Harouni.
Harouni's office was the scene of an ambush on Thursday that police say was staged by a disgruntled former patient. Tonight we are learning new details about the terrifying moments in that office from the wife of one of the survivors. NBC7's Allison Ash, as you can see, is standing by in El Cajon with the bone-chilling details. Allison.
Yeah, she didn't want to go on camera, but she told me she did want to share her husband's story with all of you. He is the office manager here, and he is still in the hospital this evening. He told his wife that when the bullets started flying, he actually played dead. George Sion and Dr. Ben Harouni together in this birthday photo that hangs on the wall inside the Smile Plus office the 2 men shared until Thursday afternoon. Sion's wife Abby told me over the phone her husband was shot at 9 times. 5 bullets hit him. Only 1 of the 3 bullets lodged in his body has been removed since that deadly shooting. Abby Sion says the accused gunman, Mohammed Abdul Karim, didn't like his dental work and demanded repairs. She says Dr. Harouni went above and beyond to correct it for free. But she said nothing made Abdul Karim happy. So in 2022, he began to, quote, terrorize the office, often showing up and making a fuss. Sion, she said, was usually able to keep the disgruntled former patient away from other staff members and patients. But she said Thursday was different. This weekend, Dr. Ben Harouni was laid to rest. His 27-year-old administrative assistant, Ureli Carrillo, shot in both legs, remains hospitalized, as does George Sion. Flowers have been placed outside the Smile Plus office, and on the door a handwritten sign wishing them both a speedy recovery. Now, we checked with El Cajon police today to find out if they'd had any calls for service involving the shooter here in the last couple of years. The answer was no. They did tell us he bought the gun he used just 2 weeks before the shooting. Now, he is scheduled to be arraigned tomorrow on a murder charge.
Okay, so any comments or questions? We've got a couple of questions and comments here. If the staff feels uncomfortable with the way any patient speaks on the phone, can they refuse service to that patient? So the problem we have is that we have siloed what the staff is doing and what management's doing and what the office manager's doing. There needs to be a system, almost an SOP of what you're going to do if that happens. Right? So let's say the patient calls and says, look, if you can't get me in there, I'm going to go out and flatten all the tires in the parking lot. Should the receptionist or front office manager make the decision, well, I'm not going to schedule that patient? It goes further than that. That patient's showing anger. They've never walked through the door. There has to be a system. Who are you going to discuss that with? The owner dentist? What is the next step? So it requires very good collaboration and communication. And that's why you have to have a violence prevention program. This is why we're getting in trouble, because we're giving this and we're delegating this to people that should never do this. We don't know if that person answering your phone is going to escalate a situation as well, right? So, and that's a good question. I work for a large practice and they're more concerned about patients' reviews and some angry patients. Therefore, they don't turn anyone away, even if they're in a threatening way towards a clinician or a clerical employee. So again, if you're in a situation where you're being threatened, first, you're going to have to deliver a handwritten note and tell your employers, this is what happened to me, and what are we going to do to correct it, right? If they're not going to correct it and you've been threatened, anytime you're threatened, you have the right to file a police report. You might not be the most popular person in the dental practice. I certainly wasn't, but you can't be retaliated against. It's also considered, workplace violence is taken very seriously by OSHA as well, right? Okay. So my reason for putting up Dr. Ben Harouni's story here, which just makes me distraught to see that, because I don't want to second guess what they did. We're going by what, the news is telling us, and gosh only knows what that is anymore. But if it's true that for 3 years they tried to handle it internally, I believe it, because how many practices out there, look how many of you are writing in right now, where you can relate to that story, right? You can relate to it. Worse than I've been a prison dentist too. I've had better security in the prison than I've had in the public health departments, by the way. But again, these weren't all in public health clinics. Some of these were really nice private practice, my own, and I just made horrible decisions, put my staff at risk. How many of you are comfortable with the decisions you're making after today? Probably you're going to have questions. I want to point you to here's a Dr. Wilkinson saying, often thought I should wear a firearm strapped to my ankle. I'm going to give you a resource here, and I'm going to ask you to give this serious consideration. This is active shooter prevention training, and this is Michael Julian, and he's in Southern California, and he's a securities expert, and he's put together a 3-hour comprehensive training on how to save your life in a situation like that, all right, where you have a shooter. And it's not necessarily mass shooting, but what do you do? It's not specifically for healthcare, but it addresses everything you need to know. And it's also great for just walking around the world. I've taken all of his classes, and we're able to now collaborate with him. We'll give you 3 CE credits if you sign up for the course. And the link is clickable in your handout. You can learn at your own pace. The video is very well done. It's in a classroom style. And he's developed this program called ALIVE, which stands for Assess, Leave, Impede, Violence, and Expose. And he started it in 2014. He's written a bestseller called 10 Minutes to Live. There are very specific things that you can be doing, whether you're in your practice or out in the world, that may save your life than trying to figure out what you're going to do at the time. And he'll teach you all those steps. So the link is there for you. I'm going to put the link in the call to action banner, and you can save it to your device and check it out later. He talks about not just active shooter, but de-escalation, how to recognize when you're in a situation that may put you at risk. And the link again is in your handout. So at the top of the screen, you'll see the link. And again, you get 3 hours of CE credit. we have offices signing up their practices for this because it teaches you how to recognize when you are in an unsafe situation. And it's unfortunate to think in this world today that we have to think about this. But if we walk around with our heads in the sand and pretend this isn't going on, it may not work out for us, right? And this is also a good course for any family members that you have or college students that are away. Okay, so I want to thank you all for being here. Oh, a husband of patient came through unlocked door looking for the dentist with intent to take care of me. Thought he was having an affair with his wife. Dentist was hiding in the dark room until the police arrived. Wow. It's not just dental offices. It's not just schools. It's unfortunately public settings. So I can tell you when I took the course, his course, it's intense, but I learned a lot. When I go into a grocery store now, I know what to do. So I have a quick video as we end here, and I know we've gone a little over, but this is someone that survived the Las Vegas Harvest Festival that actually took his course. And okay, so here's the quick video. And this is a person, one of the survivors of the Las Vegas shooting. And she took this course. And so it's eye-opening.
Live from ABC7, this is Eyewitness News.
Still ahead for us here, escaping a massacre thanks to life-saving training.
An Inland Empire woman who survived the Las Vegas concert shooting describes the special training that prepared her for a nightmare.
I just felt like if other people knew that stuff too, then maybe that would help.
She survived the Las Vegas massacre. Now a local woman is opening up about the class that she says may have saved her life. The woman says she knew what to do in the middle of all the chaos.
And she attributes her quick thinking to an active shooter training she took years ago. Inland Empire Bureau Chief Rob McMillan spoke with her and the man behind this potentially life-saving course.
I never felt like panicked. I think it was just like a reaction that we need to get out of here.
For many, the reaction to run in an active shooter situation might seem like common sense. But on October 1st in Las Vegas, when the shots rang out, Liz Marino says even her boyfriend thought it was best to shelter and assess the situation, but not her.
And then I told my boyfriend, I said, as soon as this stops, I'm running. We need to get out of here.
So why did she make that decision? She says it goes back more than 2 years to an active shooter training class she took.
I never thought I would use it. It just came back.
People default to their level of training.
Michael Julian is the one who gave her that class. Over the years, he's taught active shooter training to hundreds of people across the nation. He's now written a book about it called 10 Minutes to Live.
If you can stay alive for 10 minutes, your chances of surviving an active shooter event are increased exponentially.
Julian says one of the worst things you can do in that kind of situation is freeze. But unfortunately, he says a lot of people do.
Roosevelt said that the best thing you can do is the right thing, the next best thing you can do is the wrong thing, and the worst thing you can do is nothing. You have to do something.
Just seconds could have come out different for us.
Liz Marino says she often wonders if that class she took is the reason she's here today.
If I hadn't taken that class, then possibly it could have turned out different. And then I just felt like if other people knew that stuff too, then maybe that would help.
In Murrieta, Rob McMillan, ABC 7 Eyewitness News.
Okay, everyone, I'm going to tell you good night. The link, again, is in your handout. We don't receive monetary remuneration for this at all. And we're going to go ahead and close out. You'll be directed to the quiz. Go ahead and take that quiz. It'll also be emailed to you. Once you log out, give the server a couple of minutes and you should have it, okay? All right, everyone, thank you. I'm glad that you did that, Leslie, and let us know if we can help you. And we will hopefully see you again this week. We have a lot of live classes. Thanks so much for being here.